Hello again, this is Rick MacDermid here with Senior Solutions Group, and thanks for taking the time to check out our video, and please feel free to subscribe to our channel. I'm going to talk about something that a lot of agents who do Medicare planning don't like to focus on because quite honestly there's not a lot of money in it, and that's Medicare Part D. So the agents get compensated just a small amount for Part D drug coverage, and a lot of them don't even want to touch it with a 10-foot pole, but I think it's essential to cover it. And one of the things that I find is a lot of people is there's just a lot of confusion with Medicare Part D, and it seems like one person tells you one thing, another person tells you another, but we want to talk about some actual good news with Part D for 2021. The way Part D drug plans work, starting in 2021, the deductible, which is the first amount that you have to pay, so think of car insurance. If you get in an accident, you may have a $500 or a $750 deductible before the insurance kicks in. Well, with Medicare Part D, it's going up from $435 to $445 for the maximum deductible. Some companies may charge less or half as much or zero deductible, but the most that they're going to be able to charge up front is going to be $445 in 2021. Then there is a initial coverage where you're going to pay about 25% or less of the cost of your drugs until your drug costs equal $4,130 in 2021. Then you enter what's called a coverage gap, also known as the donut hole, where you pay 25% of the cost of your drugs. That may increase the cost of your drugs or decrease the cost of your drugs depending on the cost of your drug. So the key word is 25%. The manufacturers will pay 70%, and then the government will pay, or the plan itself will pay 5% of the cost while you're in that donut hole or the coverage gap. Then if you have a catastrophic coverage amount, that would be $6,550. Medicare itself will pay 80%. The plan will pay 15%, and you'll pay 5% of the cost of your medicine during that amount. Well, guess what? We have breaking news for 2021. President Trump signed into law the new senior savings model, which takes effect January 1 of 2021. So this is great news for people who are taking insulin. About 1/3 of people on Medicare are diabetic, and a lot of them are taking insulin. So millions of people across the good old USA are taking medications, insulin, that run possibly hundreds or even thousands of dollars. So the problem with insulin is you have to always pay the deductible up front in most cases, unless your plan waives the deductible. Those plans are typically more expensive. So the deductible, again, next year will be $445. This year it's $435. And then you have to pay co-pays, which could be $40 or more for insulin, maybe $70, maybe $100. And then you get into the coverage gap, also known as the donut hole. And then you get into catastrophic benefits once the cost of your medicine equal about $6,300. Well, guess what, folks? In 2021, insulin will be $35 for the plans that participate in the senior savings model. So the Model Part D drug plan, the average person on insulin will save $446. That's a big deal. That's huge for people that are on a tight income or a limited fixed budget. So guess what? $35 across the board for the entire year instead of paying an upfront deductible can be huge for next year. So get ready, folks. If you have questions about this, let us know. Contact us at seniorsolutions.net or at 509-494-4288. Again, subscribe to our channel and pass the information along.